Good afternoon, everyone, and welcome back to another session of our pre-medical presentations. Today's topic is thermal physics and medicine. I'm your host, Ms. Shenando, here as part of corporate communications. These are weekly presentations from various faculties. Mondays are pre-medical, Tuesdays, preclinical, Wednesdays, research, Thursdays, medicine and surgery, Fridays, combination of health sciences, nursing, pharmacy, and more. These are presentations for our students by our students. This is a platform where we foster a very strong foundation within our students, skills on public speaking, self-presentation, presentation making, as well as online etiquette. That would be engaging with those of you in the audience, how to speak, how to respond to questions, and the like. This is also an opportunity for you in attendance as part of the audience to learn and get comfortable with the mechanisms of a webinar, how to ask your questions, how to use the chat, how to raise your hand, and more. I would like to acknowledge the presence of our professorial team, Professor Njelisani, Professor Lambert, Professor Mudenda, Professor Mwaba, Professor Mulenga, Professor Mwansa, Professor Viemba, Professor Kasolo, Professor Gilani, Professor Emaus, as well as Professor Kumar, and many more. I would now like to invite our moderator to briefly introduce the topic and begin the presentation. Madam, the floor is yours.
Thank you all for being here. It's a pleasure to welcome you to this student's presentation on thermal physics and medicine. Today, we'll be hearing from 4 of our students who have explored how thermal physics and the thermal physics principles intersect with modern medical technologies and treatments. The aim of the presentation is to bridge the gap between theory and real-world applications. Each student will have about 10 minutes to make their presentation, and they will introduce themselves. Please hold all questions until the end of the presentation. Let us begin.
Good afternoon, everyone. Good afternoon. My name is Nasrullah, first year second semester student at Lusaka Medical University under the Faculty of Premedical Sciences. Today we are going to dive into the topic thermophysics and its application in the medical field. Thermophysics is simply a branch of physics that deals with the relationship between energy and heat. Thermophysics plays a vital role in medicine, particularly in treatment and diagnosis. Therefore, under this topic, we have some subtopics that are there. So we are going to explore those topics and see how they are applied in the medical sector. We have heat and energy, specific heat capacity, treatment, and thermodynamics. What is heat? People wonder. Heat is energy transferred due to temperature changes. Then how then can we apply this concept into the medical field? We can apply this concept in situations whereby we have sportsmen and women. Then someone, a muscle. In case of muscle, heating pads are recommended in order for the muscles to be relaxed or to relax the muscles that are contracted. And in sports, we also have situations whereby 2 players collide with each other. Therefore, an inflammation may arise from that origin. So we normally see in football or in any kind of sport, when such an event happens, you'll find that there are people, those medical personnel, who rush in with kits. In those kits, there are some ice pads where they'll put the ice pad on them on that information, then the information may reduce. Internal energy. Internal energy is simply the total kinetic energy and potential energy of the molecule in a system. This concept is very important. Why? We can put this concept in terms of both temperature regulation and in understanding fever and hypothermia. Fever is simply an increase in body temperature beyond the normal body temperature. And hypothermia is the decrease in body temperature beyond the normal body temperature. Therefore, if we have fever, or if someone is having fever, then the medical personnel has learned physics and who understands the concept of internal energy will be able to treat such a person easily. We'll come back to it in a while. We have kinetic energy of a molecule. Kinetic energy of a molecule is simply the kinetic energy of a molecule due to the movement of that molecule. So what are the applications of this kinetic energy of a molecule? We have drug diffusion and molecular motion in body temperature regulation. We start with drug diffusion or drug diffusion. Drug diffusion, if the internal body is having a high temperature, it means that the drug that has been administered to that person will dissolve or will diffuse easily into the cells. This is highly, such kind of medications which are highly dependent on it, are medications that are taken oral. Such an example of medication we have Panadol, which is paracetamol. So when you take that pill, it gets into your body. If the temperature in your body is high, then it means that even the process of diffusion becomes faster. But if the body temperature is too slow or too low, then the diffusion of that drug will be very, 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 very low. Hence, the person may end up dying, or it will, it will lead to delayed diffusion of that drug. We have a molecular motion in body temperature regulation. We have molecular motion in body temperature regulation. Let me put the understanding of kinetic molecules. Yes, we can simply the body temperature. If we understand how we can regulate this body temperature, then it is easy for us to administer any kind of medication that is supposed to be administered at that time. Because you find that some medications, though they are taken orally, they take time to diffuse. And there are some medications whereby when you just take it, it diffuses. So if someone is having hypothermia that I said previously, then you can give such person such kind of drugs. But if the fever is good, then we know what kind of drugs to give such a person, which will reduce the temperature. So if we understand how the body temperature is regulated, then we can use any form of medication that the body requires at that time. Let me give you an instance whereby if someone is having fever and the body temperature is too high, or yeah, someone is having fever, the body temperature is too high, then we know that if we give this kind of drug, it can diffuse very fast and it will lower the body temperature. But if someone is having low body temperature, then you give that person a drug which cannot diffuse fast. That will lead to delayment in the drug to work in the body. I've come to the end of the part of my presentation. Left for my continue the presentation.
Good afternoon, ladies and gentlemen. My name is Elias, a first year student in the pre-med faculty. And my duty today is to present to you a continuation of from where my colleague has ended. That is thermal scales and thermal expansions, their application in the medical field. Basically, we've got three well-used calibrations or scales. That is the Celsius, Fahrenheit, and the Kelvin. The SI unit is basically the Kelvin. But as a medical practitioner or as a medical student after your graduation, you will discover that the world is a global village these days. You might practice in Germany where they use Fahrenheit or elsewhere where Kelvin is applicable. So essentially, in physics, we are taught thoroughly how to use this interconvertibly. In other words, there is a formula that you can use if you are converting Celsius to Fahrenheit, Kelvin to Fahrenheit, or Kelvin to Celsius. Without delving into much detail, maybe I'll just give briefly of how you can actually convert. You are given the normal body temperature of a human being as 37 degrees Celsius, and then you find yourself in Germany, where you are using a thermometer which is calibrated in Fahrenheit. What you simply do is that you take your figure in degrees Celsius, you multiply it by 9/5 or by 1,8, then you add 32. You have a Fahrenheit. Then if you find yourself wanting to convert Celsius into Kelvin, you simply add the figure in Celsius to 273.15. Then you have your figures in Kelvin. It is very, very important for you to know how to convert these degrees or calibrations from one to the other. Accurate patient temperature readings are very, very important in medicine because in diagnosis, the variation in body temperature is an indication of further complications in a human body. So from a thermometer point of view, you are supposed to be knowing how to convert those. Then also, even in the thermometer itself, you will discover that the materials that are used to indicate body temperature take advantage, or they actually use what is called coefficient of thermal expansion. For example, we've got mercury, which have got a very high coefficient of thermal expansion, which is used to take temperatures. And I'm going to go on to look at the thermal expansion bit and how it applies into the medical field. Materials do expand when they're exposed to variation in temperature. They expand if temperatures rise, they contract when temperatures are low. This is fundamentally very significant in that implants make use of this phenomenon in physics. So there are what are called, I'll give the example of 3 examples. One example is self-expanding stents. For example, there is a need to correct a constriction of one of your lumens. Maybe it might be a blood vessel. Maybe it might be in the GI tract. They use what are called self-expanding stents. They contract it, they expose it to low temperatures, it contracts, then they insert it into your system. Then once it's inside your system, it is expanded by your body temperature, which is warmer. And thereby, the vessel is put back to its correct diameter. Then we also have implants which are used in the orthopedics. Right, the bone is broken, and there is a need to put a metal there to correct it. That metal, before it is put, the medical engineers must take cognizance of its coefficient of expansion such that to avoid inflammations or complications complications that might happen between the interface of the implant and the bone itself. Then we also have implants that are used in the dental therapy, dental treatments. You know, when your tooth is having a cavity, they extract whatever is there and then they put a substance, a metal. That metal which is being put in the tooth, they make sure that its coefficient of expansion is not more than the coefficient of expansion of the tooth. Otherwise, the tooth will crack when they eat hot food, or it will over contract and leave further cavities when they eat cold food. So these are all very important physics topics which were taught by our lecturers for us to prepare us to be relevant in the medical field. Basically, as I wind up, I would want to say the major consideration that is put into implants is the coefficient of thermal expansion. It must be the correct one, and it must compare well to the tissues in the human body to avoid inflammation or technical breakdown of the implant itself. Ladies and gentlemen, thank you very much for giving me your attention. I would want to call upon the next presenter.
Good afternoon, ladies and gentlemen. My name is Eunice Bikausar, and a first year, second semester pre-med student. So I'm here to take you through the specific heat capacity. Specific heat capacity basically is the amount of heat that is required to raise the temperature of a unit mass of a substance by 1 degree. It is given by a formula. Q is equals to mc delta T. And this formula can be rearranged for us to be able to calculate the specific heat capacity. To C is equals to Q divided by mass multiplied by change in temperature. So, medical applications of specific heat capacity. Specific heat capacity is important in therapies, diagnostics, and process design. I will delve more into the therapeutic side. So in the therapeutic side, I have seen so much relevance of specific heat capacity in cryotherapy. What is cryotherapy? Cryotherapy is the use of extremely low temperatures for therapeutic purposes. It can be applied in wart removal, cancer treatment, numbing of pain in the sports field, and keloid removal. So on this slide, there is appreciation. There are images that are meant for your understanding of certain medical conditions where cryotherapy can be applied. So on the first image that is on the top of the slide, the image is showing a keloid. A keloid can arise due to piercings, some cuttings. So cryotherapy is very important in the removal of those keloids. As some ladies during piercings, they might get those keloids, they might not feel comfortable after getting those keloids, they might want to remove them. So other methods of removal may result in further complications or enlargement of the keloids. So cryotherapy is preferred. On the bottom of the slide, there is another image there, a get image from the internet, which is showing cryoablation. Cryoablation simply is the removal of tumorous cells from an early stage of cancer development. So it is used in early stages. So cryoablation is used in early stages of cancer treatment. So in our present day, we have seen a rise in cancer patients. So the knowledge of cryotherapy is important in dealing with such cases. So now that I have talked about the medical side on the cryotherapy, we want to link the specific heat capacity to the medical side. So specific heat capacity allows us in the selection of a cryogen and also allows us to have more information on tissue cooling efficiency. So on the selection of a cryogen, some may be wondering what a cryogen is. A cryogen basically is the substance that we are using to reduce the temperature or to absorb heat from the specific tissue that we want it to die so that we can remove it. So since cryotherapy uses the information on the death of a cell by ischemic necrosis, whereby we constrict the blood vessels that are supplying the part we want to remove, and the oxygen supply to that part is cut, the tissue is died, and it will be easy to remove the dead tissue. So we move to the selection of a cryogen after understanding what a cryogen is. The examples of cryogens that are relevant to the medical field, I understand there is a large list of cryogens, but I just selected the ones that are very relevant in the medical field, which is liquid nitrogen, dry ice, and argon gas. So when choosing a cryogen, that's when the knowledge of specific heat capacity comes into play. You would find that when choosing a cryogen, we would want to have a cryogen that has high specific heat capacity. This improves our cooling efficiency of the tissue we are dealing with. And also a cryogen that has high specific heat capacity changes temperature slowly. It absorbs more heat from the tissue before it even changes its temperature. Therefore, it prevents a situation whereby we destroy the normal cells around the defective ones. We then move to tissue cooling efficiency. You would find that different body tissues have different specific heat capacities. So the tissues that have high water content, they have high specific heat capacity. What does this mean? It means those tissues, they take long to cool down. They need a cryogen that absorbs so much heat from them compared to the ones that have low specific heat capacity. So the table is for you to appreciate the different specific heat capacities on the different tissues that we have in our body. Their skin is showing 3.4, fat 2.3, muscle 3.5, blood 3.6, tumor 3.4 to 3.8. There's a range for tumors there. And for the bone, it's 1.3. So from the table, you can see that those tissues that have high water content have high specific heat capacity, tumors there, and blood, obviously. You see that the bone has the least specific heat capacity, as it has got the least water content compared to the tissues that are given in the table. Just to sum up on the specific heat capacity, the knowledge of specific heat capacity allows the medical personnel to have much understanding on the tissues that they are dealing with, and it then allows them to choose the proper cryogen to use. You might not be able to use the same cryogen in different tissues. This is the end of my presentation.
All of you, ladies and gentlemen, and everyone watching. My name is Sean Mabeni, or Mawenri from Zambia. So I will be talking about thermodynamics. And specifically, we'll be going through the two laws of thermodynamics. Alright, so let's dive right in. Alright. So here we have the first law and we have the second law. The first law is pretty much one of the most common laws in physics. So what does it just tell us? Energy, you cannot create it, you cannot destroy it, but you can only convert it from one form to another. So I will now pose the question, which I hope by the end of this you'll be able to answer. Why do you need food? So when our main sources of food, let's say you consume, for example, glucose. You will consume glucose, which is going to give you chemical energy. When that glucose is metabolized, it will release a lot of heat. Some of these heat will be converted into ATP, ATP which will be used for, well, a range of things like muscle contraction. But the vast majority of this heat is going to be wasted, basically. But not all of it will be wasted per se, because the body, well, evolution of God thought, what can't I design this body in such a way that it can harness this heat energy so that it can maintain a constant eternal environment. In other words, what we call homeostasis. And then the rest of the heat, which won't be utilized, will just be dissipated into its environment. So now we come to the second law of thermodynamics. This one is the most important law in physics, most important, most widely applicable, and in some cases it can be the most terrifying law as well. So forgive me for giving you this very long definition, but it is the most applicable in this. But anyway, in simple terms, the second law of entropy tells us that entropy must increase or with time. So what is this thing which we call entropy? Simply put, entropy is a measure of the disorder in a system. The greater the entropy in a system, the greater the disorder there is. The lower the entropy, then the more ordered the system is. Now we shall take this application into the implication. We'll start off with the body. The body can be thought of as being a highly ordered system. What do we mean by this? In other words, since it's highly ordered, it means that it has got a low entropy. This is a law of thermodynamics tells me that entropy must increase. And yet, for some reason, the body decreases on entropy. So, thus, the body violates this most sacred of laws. Well, we know because there's a simple solution to consider there. The body, for example, when it metabolizes whatever food it does, some of the energy will be used to lower its entropy. In other words, to make the body more ordered, but the vast majority of it will be given off as wastage, which will end up increasing the entropy of its surroundings. So that's how it complies with the most holy law in physics, the second law. It increases the entropy of its surroundings, but itself it will try to make response. However, this in order requires food. That's why we need food. Why do you need food? You need food in order to maintain a low entropy. If your entropy increases, you are close to die. By the time you reach maximum entropy, well, you're dead. So that's how it is. But work must be done continuously to prevent your well-ordered body from falling apart. In this work, we derive it from chemical energy, which we find in food. Yes. So this is just a diagram to illustrate this. You consume some food, you gain chemical potential energy from it. The body does some sort of work, for example, for growth, for repair, all sorts of things, but some of it, the majority of it, will be wasted in the form of wastage. Now we shall consider the implications, the thermodynamics. We'll consider thermodynamics entropy in life, how it applies in medicine. Life. What is life? One of the hardest questions to answer. You know its characteristics, but to give you a proper, precise definition, you can't do it. Well, thermodynamics can come to the rescue. What is life in a thermodynamic sense? Life can be thought of as being a low entropy, non-equilibrium, open system. So what do we mean by this? Simply put, by being low entropy, the lower the entropy, the higher the order within the system. It's not in equilibrium with its surrounding, which is apparent. Consider the simple cell. Cells, we know that they are not in equilibrium with their surroundings. They maintain some types of gradients with their surroundings. For example, electrochemical gradients. If these electrochemical gradients were to collapse and the cell equilibrates with its surroundings, then that's pretty much the end of life. Then why do we also refer to it as being an open system? By this, we just need to say that it is able to exchange energy in matter with its surroundings. So that goes there. So therefore, in light of this, what can we consider about health? What is health? We know we refer to health as being a condition of physical, mental, and social wellness. That is the physical definition of health. No problem with it, but in the end, for you, from a thermodynamic sense, for you to be healthy, you must maintain a low level of entropy. So there are conditions now. In this case, we are talking about disease. Is disease now from a thermodynamic sense? You can just consider entropy now. I mean, disease has been simply put a condition in which the body is unable to maintain its low entropy state. And very many diseases, for example, viruses contribute to this. Viruses have got a much lower entropy than the body. And since we know that viruses attack our bodies, they are going to order themselves, but at our expense, essentially. So we can actually use entropy to explain, in a way, the action of viruses. How can we do this? We can consider, for example, entropy, or to be precise, what would be referred to be the Gibbs free energy. So let's say you measure the Gibbs free energy of a virus, then you measure the Gibbs free energy of its target organ. Then you determine that ratio, Gibbs free energy of virus to Gibbs free energy of target organ. And if it is greater than 1, for instance, what this means is that it is thermodynamically favorable for this virus to essentially take over the cell's machinery and use it to produce its variable. So if it's greater than 1, it means that it's thermodynamically favorable. It will encourage the virus will multiply a lot, utilizing our bodies, our cellular machinery, and then the cell will fill up with these virions now, and then it will burst now. So that sort of situation is common in types of viruses which don't have a repeat envelope. Yes. But then in the second situation, maybe this ratio of group of Gibbs free energy, maybe it's not, maybe it's less than 1. If it's less than 1, that means that it is not thermodynamically favorable for the virus to take over the cell's machinery. In this case, what will happen is that, yeah, it will multiply, but not enough to burst the cell. So instead, these new virions just leave the cell by forming just bag of indigo. So that's how it is. This is still an active area of research because unfortunately we have not yet catalogued the thermodynamic characteristics of all the viruses in all the cell tissues. But if you're interested, we now know what to research on. Yes. And then lastly, we'll just consider, okay, for health, what then is the need for medicine for you? Medicine, we can consider it as being trying to the best of our abilities to ensure that the body maintains a low entropy state for as long as possible. Sadly, we cannot always do this. By the time you are old, your entropy levels are building up, and then eventually you die when you reach maximum entropy. Yes, that is my presentation. Now, I would just like to conclude on our behalf. Many people think that physics it has no application to the medical field. Well, that is a big fat lie. It is very, very applicable, and unfortunately, it is not. We have not even fully applied it. Really, there are still many ways in which we can apply. Over here, we've just demonstrated how thermophysics can be utilized to either to understand physiology better, either to utilize it. For example, the principal specific heat capacity, we can utilize that. For example, with text, it has been demonstrated. The applications are endless, largely limited by our imaginations. I thank you.
Okay, thank you very much to our presenters. Another round of applause to them. Oh, other people interested. Brilliant presentation. Madam Shinondo, over to you.
Thank you. Job well done, presenters. Job well done. Now, before we move on to question and answer session, I would like to invite members of the audience to just let us know where they're listening from. Are you listening from any of our LAMU campuses, whether it's Chalala, Mutandwa, wherever it could be? Please let us know in the chat. Those of you who are listening from out of town or maybe in your placement sites, please feel free to let us know. Would like to know. We have a comment from Timothy Mwanza. That was wonderful, Sean. You've done a wonderful presentation. than the word itself. We have Natasha Milimo listening from Chipata, Chalala campus. We have another one, Peterson, Chalala campus. Excellent. Where else are we listening from? Once again, these presentations are for you. So please, please take full advantage of them. This is your chance to ask all the questions as well as getting acquainted with the platforms so that one day you will get comfortable enough to also take a shot and present. We have more people listening from Chalala campus. We have one from Shangombo, Western Province. Madam Josephine, welcome. Well done. Well done. We have Mrs. BK from South Australia. You're most welcome. Thank you. Please feel free to continue letting us know where you're from. In the meantime, question and answer session is now open. The nature of how you ask your questions, you can simply raise your hand, the floor will be given to you and you can ask your questions, or you can write your questions in the chat and they will be read out for you. This is your time, dear audience. This is your time.
So as I'm waiting for the audience, I've got a question. It was special covered. When people are playing football and they get injured, normally the physician will run to them with an ice pack and then put it on their foot. Why do they do that?
To reduce the information that's been done with the information.
Okay, thank you. So the ice will bring about the vasoconstriction. Vasoconstriction will result in reduced inflammation. Therefore, you're not going to have the pain and the swelling. Then ice will also limit the transmission of the pain impulses. Thank you. Any other question from our audience? You can raise your hand or you can type the question in the chat box. This is PK from South Australia. Any comment on today's presentation? Would like to hear from you.
I don't have a comment, but I would like to say well done, guys, for such a good presentation. Thank you.
Thank you very much for that contribution.
Please, once again, do not hesitate to ask questions. I would also like to find out, do we have any members from our professorial team with us?
Yes, can I say something?
Yes, please. Professor Lambert, you are most welcome.
Yes. So I want really to thank the team for the well done presentation. Can we clap for this? This is the kind of standard we want to have in Africa. But congratulations.
Thank you.
Congratulations. So Mondays will be used for this purpose. And I'm also thankful to the one who has participated from Australia. Can we clap for that? The aim is to internationalize the institution through programs like this. All faculty, that are taking part. Mondays is pre-med. Tuesdays preclinical. Wednesdays is research, participate, and Thursdays MPCHP. Friday, that's where there's nursing, physiotherapy, all those health sciences, the share Friday. So Monday to Friday, we are fully booked, same time. But this one, I'm very happy. By the way, University of Zambia had employed a biophysics lecturer, 1972. Our class was very lucky to be taught biophysics, 1972. And that lecturer did not last long. He was really forced out of us. He had come from Sri Lanka and he came to University of Zambia, taught for 1 year, and the biophysics is a hot topic. As you can see from your presentation, it's highly applicable. Understand the human body, every cell, and where it is critical, more mitochondria. I think one of you mentioned ATP. That's heat generation, production of heat at cellular level. Pursue that one. And two, when a body is challenged following accidents or severe infection, the survival mechanisms apply a lot of biophysics, in it. And you will see that when you are following the survival and the repair process, especially survival period, management of temperature is important. We have what we call systemic inflammation response syndrome. Systemic inflammatory response syndrome. Severe injury and severe infection. That's something which you should watch out. And the temperature can be high or can be low. There are still features. Then we count the respiratory rate and the cardiac, rate. The pulse rate, respiratory rate, and then temperature, both the hyperthermia and the hypothermia. These are the four features of systemic inflammatory response of the body. When it's traumatic or it's severe, you will apply this knowledge. But what I'm begging you, please, I lost my notes of 1972. I lost them. How I wish I kept them. What you are learning now is a high quality knowledge that you will need to use throughout your practice of medicine. Can we clap for you for keeping the information? You not need to, you can stop all this information. Now what I'm asking the dean, suppose with whatever physics like they are doing now with mathematics, combine the two approaches, mathematical model, bring them into biophysics and combine. So they did, why don't we develop a curriculum for biophysics? We are training health workers. I think we can have a part of the physics curriculum to concentrate on biophysics. So what will happen to this planet? The heat is going up. Temperatures are going up. What will happen to the human body? This knowledge you have is what will be giving out answers. Don't lose this knowledge. The planet is in danger of extinction. What can we do to cool down the planet. Start thinking. But you can enter it through human body science. Because humanity will understand faster if you tell them there will be extinction of human life if we are not careful now. This is the global issue, global problem. Let's start building it at your level now. Unite and start research on what will happen. Lusaka Medical Invest has a big research plan in Funsa. I keep on mentioning. When you qualify, don't detach yourself from Apple. You will contribute. Wherever you will go, you will be doing research. Come and present. Our research center is big. Land alone 4,500 hectares. Then you multiply by 2.4. And the trees we have saved there, natural one, 3.9 million natural trees are preserved just in one area. But Apex has been a step ahead from 2017. Every province will preserve the forest for research purpose. Please, let's work together. Only this, if you Apex will love you, you will always be connected to it. So this is the foundation of knowledge. But please work extra hard. Encourage and list these young people who are presenting so well, so that we trace them where they'll be going. Wherever they go, like knowledge, we trace them until we build the scientific base in Lusaka basement. That's my prayer. Thank you very much.
Okay, thank you. So today at 17 hours, we have if there is a question which is coming from today's presentation. I won't tell you which one. This is one of the advantages of attending these seminars. So question one, which of the following statements about internal energy and its practical application is correct? Internal energy is solely the potential energy of the molecule within a system. An increase in body temperature will lead to a decrease in the average kinetic energy of the molecule. Drug diffusion in the body can be influenced by kinetic energy of the molecules, which is directly related to the temperature. Hypothermia increases the internal energy of the body tissues, speeding up metabolic processes. We can type in the correct option. Mr. Zul, what is the correct answer? Still thinking. The audience, we can type in the correct answer. For typing.
Not yet.
Question one, anyone? The ODL student is very happy with the presentation and has learned a lot. Kindly tell us the correct answer. Okay, that is correct. From the presentation, C is the correct answer, right? Okay. Thank you. Okay, more people are not getting the correct answer. Question two, what is the 7 degrees in Kelvins? We can type the correct answer for question two. The participants feel free to participate. What is the correct option there? D is the correct option. Samuel, is that correct? Yes, Miss Wanga, that is correct. It is indeed correct. So the 7 degrees in Celsius is 310.15 Kelvin. According to specific heat capacity, which of the following tissues cools quickly? According to specific heat capacity, which of the following tissues cools quickly? We have muscle, bone, and blood with their indicated specific heat capacity. Yes, those. That is the answer for that should have been for the previous question. We are now on the third question. According to the given specific heat capacities, which of the following cools quickly? Muscle, bone, and blood. Who is answering this question? Is B the correct answer?
It is. I think that answers to the previous question.
Yes. Participants, over to you. Bone. From Miss Jessie Riambo. Is bone correct?
Yes.
If bone is correct, it has got a very low specific heat capacity. Then blood made up of plasma, which is about 90 to 92% water, has the highest specific heat capacity. The more the water, the higher the specific heat capacity. Okay, application. So we've got a different number of questions, different type of questions. We have the core. Now we are looking at a question which deals with application. According to Bloom's taxonomy, a virus has a Gibbs-free energy change of negative 50 kilojoules. It is known to attack organ A, which has Gibbs-free energy of negative 25 kilojoules, and the organ B, which has a Gibbs-free energy change of negative 10 kilojoules. Which tissue is it most likely to infect, and what is the infection mode? A virus has a Gibbs-free energy change of negative 50 kilojoules. It is known to attack organ A, which has Gibbs-free energy of negative 25 kilojoules, and organ B with Gibbs-free energy change of negative 10 kilojoules. Which tissue is it most likely to infect, and what is the infection mode? Organ A lytic, organ B lytic, organ A budding, or organ B budding. That is now application. At our level course, we mainly deal with report and application. In first year, they cannot create, which is at the top of Bloom's taxonomy. The final question in our audience. Anyone? This should be the one that we should bring in the piece. We think what in this one. Anyone from our audience? Jesse Zulu going for A. Is that correct? Yes. That is correct. Organ A lytic. So viruses will multiply. After multiplying, they destroy that cell. They do not bud. They kill it and then they move out. Typical of HIV. Okay, we have come to the end of our presentation. Next week, we are going to have a presentation from the biology department. I've been seeing one or two a day. Keep up the good way. Our presenters will become very elaborate and eloquent. We are requesting for more of our students who've never participated before. So when we have biology, we are going to have more the first and first seconds. But for the others, please continue participating. If you look at the way you did your first presentation and now, we have a huge improvement. You are now experts. Keep up the good work. Ms. Shinondo, over to you.
Excellent. Thank you. Well done, participants. Well done. Shall we please have a round of applause for our Dean, Dr. Chua? Thank you so much for taking us through that. Normally, these types of quizzes and the like, they prepare you for what will possibly come later on, and these go into our question bank. So the more of these presentations you attend, the more knowledgeable you'll be. Now, I believe we have come to the end of today's pre-medical presentation. Do we have any last questions before we move on? None? All right. I would like to invite our moderators, our presenters, to give their closing remarks. Presenters, the floor is yours.
Good afternoon once again to everyone. I would like to thank the Lusaka Apex Medical University leaders for affording us this opportunity to get into the researching side on how what we are learning can be implemented when we are going to major. So thank you so much for the opportunity.
Okay, thank you once again to all our speakers and to everybody who was present in this presentation. We appreciate your presence and your support. Thank you so much and have a good day. Concludes our session. Have a wonderful afternoon.
Excellent. Thank you. I'd now like to invite our members of our professorial team, Professor Lambert, to give us his closing remarks.
On behalf of the Vice Chancellor, Professor Nyerizani, and the CEO, who is also a top physician in the Ghana, Professor Peter Ma, and of course the Director of Medical Education, Professor Mudenda, and the Deputy Vice Chancellor in charge of Research and Innovation, Professor Mulenga, and all the senior members of staff. I'm saying thank you very much for this presentation. Have a WhatsApp group with your teachers. Don't let it go off your mind. WhatsApp, read more, and try to think how you could apply when you qualify as a doctor. How you keep this knowledge, apply either in your research or clinical center. As I told you, what we are presented today, when someone is seriously injured or severely infected, severe, The first 48 hours, we call it epipay. The dynamics, the biophysics you have talked about are extremely important whether the patient will survive or not. 48 hours. So as a practitioner, you have to be close to the patient. Don't leave critically injured patients alone and apply your knowledge. You will save many lives. Medicine is continuous care, and I would like also the nurses to participate in this program. We are pleading with all the deans to encourage their team to participate. Because nursing care at the bedside, you can imagine the importance of temperature and what is happening to the human body. On a temperature basis alone, you can interpret a lot of things. So please maintain this knowledge. I've asked you to have a WhatsApp continuously. Don't lose this topic and become the authorities on how the human body handles temperature. Climate change is a real danger. It's your things like this who contribute the idea on how we can mitigate, how human body will adapt into the coming heat, environmental heat that is going on. So please, I want to thank the Dean of Pre-Med and during the meeting, all things should participate so that they can encourage their faculty students to participate in this type of information. It will build the university to the very handling and global level in terms of talking and teaching. Did you see the participation from Australia? I'm very excited. Your team maintain those contacts. That enriches our presentation. May God bless you and bless the institution. Thank you.
Excellent. Once again, Faculty of Premedical Sciences, job well done. I see we have a round of applause from our members in attendance. Please and thank you. I would now like to remind members of both of our professorial team as well as our presenters, at the end of this presentation, please make your way outside to take a group photo. This is history in the making. Do not miss your moment. And with that, we've come to the end of today's presentation on thermal physics and medicine. Enjoy the rest of your day. Thank you.